With a handful of Ebola cases being treated in U.S. hospitals, it's likely that we will continue to see those false alarms we've been seeing.
Yeah, I think that's going to continue to happen. Yesterday, a patient was briefly admitted to Christus St. Vincent Hospital after reporting some symptoms. Nikki Ibarra joins us live from our newsroom with some things you should know about Ebola symptoms. Nikki?
Yeah, Nicole, good morning. A lot of the questions we've been getting is the symptoms, and we've learned that the symptoms with the flu virus and Ebola are very similar. In fact, for the early stages, they're definitely similar. We're talking about headaches, body aches, fever, so those things are very similar. But past the early stages, Ebola and the flu are extremely different. Now, we talked to Dr. Jeffrey Thomas with Loveless Medical Group. He says people in this area do not have to be concerned about being exposed to Ebola. People are not at risk unless they've traveled to what health officials are calling the Ebola hot zone, Liberia, Sierra Leone, and Guinea. Here's some key points from the CDC website, which we found. You can contract Ebola by touching bodily fluids from an infected person, syringes, or infected animals. Ebola symptoms show up between 2 to 21 days after exposure, and those are listed there on your screen. Now, the virus can only be spread to others after symptoms begin. Well, here's what else the doctor from Loveless had to tell us.
The similarities between the flu and Ebola are really their initial presentation. Fever and viral symptoms are going to be what you see with both diseases.
Again, you heard it there. The flu and Ebola early stages symptoms are very similar. Again, fever, muscle aches, headaches. We do know the Santa Fe patient did travel to Africa, but they visited Kenya and Tunisia, not places affected by the Ebola pandemic. Reporting live in the newsroom, Nikki Ibarra, KOB Eyewitness News 4.